Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County. Today, joining us for COVID conversations and more. Today, we have joining us Kim Gandy, who works at Douglas Public Health Network as their Overdose Prevention Coordinator. So first, we'll go through COVID, and then we're going to learn about the incredibly important work that Kim and her colleagues at DPHN are doing to help prevent deaths from overdose. So again, if you have questions, please send them to us. I did not see any questions this week, but if you do, please send them to us at Facebook questions at douglaspublichealthnetwork.org. So it's a big, long address, but Facebook questions at douglaspublichealthnetwork.org, and then we'll get to those next week. Well, the good news is that the world of COVID is really quiet this week. The world has seen a flat number of cases. There's still some countries that are dealing with a high number. I think South Korea, Australia, Hong Kong, and Taiwan are dealing with high numbers of cases. But much of the rest of the world is quieting down, and that's a good news. The U.S., the cases are low, although we're beginning to see an increase in the cases caused by BA2. So let me explain this. So Omicron has two variants, the BA1, which circulated in much of the world in December and in Douglas County in January and February, but it has a cousin, which is BA2, which is also part of Omicron, slightly different, a little more contagious, probably not more serious, well controlled by the vaccines, less well controlled by sotrovimab. And what we've seen in places in Europe, and now we're starting to see in places in the US, is that they went through a BA1 surge. They had a really quiet time, and now they've had a smaller but still significant surge of BA2. So in the US, we're starting to see a surge of BA2. New York and Washington, who were early on in BA1, now having a little bit of a BA2 surge. The good news is that hospitalizations there have not spiked because we do have some now preventives, and vaccine has worked pretty well to prevent hospitalizations and deaths. In Oregon, we saw a slight increase in cases in the last week as BA2 comes to Oregon. We have not seen any BA2 yet in Douglas County, but like in every surge in the past, it's going to get here. When it's going to get here, we don't know, but I would think it's likely to get here sometime in the end of April or the beginning of May. There was a prediction made the other day that it might not get here until the end of the summer. I think that's overly optimistic. I think it's likely to get here in April or May. It's likely not to be huge. No place has seen a really huge surge of both first BA1 and then BA2. Some places have only had BA2. Some places have had BA1 first and then BA2. And I think that's what we're going to have here. But right now, we're at a very low number of cases. We had just one case yesterday, which I think is one of our lowest numbers in a year. And so right now, we're having a relatively low amount of disease. A couple of important things. One is with vaccines. Vaccines still work, and they work against BA1 and BA2. They're not that great at preventing infection, but they're really good at preventing hospitalizations and deaths. Maybe a 10-time lower risk for somebody who is vaccinated and boosted than somebody who is not vaccinated. And again, when we look at our local deaths, they are overwhelmingly, again, among older people who are not vaccinated. And since most of our older people are vaccinated, it really shows that the vaccine does work. The other new news in vaccine this week is that for people who are 50 and above, or for people who are immunosuppressed, there's now an allowance for a second booster. So there's some things that are strongly recommended, some things that are allowed. This is allowed, and I'm going to get mine next week. But this second booster gives further protection against illness, hospitalization, and death. So we have plenty of vaccine available. All of the clinics in town have vaccine. We delivered well over 1,000 doses this week. So again, if you're interested in getting vaccine, please talk to your provider so you can get a booster. Well, if you've not had a first booster, the first booster gives you the best protection. And the very biggest increased protection is getting your first dose. So if you've not had any doses, get your first. If you've had your first, get your second. If you've had 2 doses and need a booster, get a booster. If you're 50 and above and had 1 booster, please get another. Again, this is a good way to help prevent us from having this big surge. In addition, we are now having increasing amounts of drugs to treat COVID once you get it. You'll remember back last summer, there was an monoclonal antibody called Regeneron. Regeneron worked great against Delta, but not so great against Omicron. So then we went to sotrovimab, an antiviral agent that helped against Omicron, but doesn't work against BA2. And now there's a new one called bebtelovimab that works against BA2. And we have some doses of that here in town. So if you're unlucky enough to get COVID at this point, please talk to your doctor about getting one of those monoclonal antibodies or one of the oral antiviral meds, so that there are 2 oral antiviral meds, one called Paxlovid, one called Molnupiravir. Both are here in town and available. So if you're unfortunate enough to get COVID, please talk to your doctor about getting one of those drugs if you're in a high-risk group. So overall, I think things are going well. We now in public health are shifting a bit away from COVID. So we, for the last 2 years, have been living COVID every day. And we have this big, great team that's helped us to do that. And Kim actually was one of the leaders of the team. I can't remember your color, but we had 4 color teams, and Kim was the head of one of those. And she's also been our overdose prevention specialist. And now I think she's going to be doing a little less COVID work and a little more overdose prevention work. But overdose prevention work is important because during the pandemic, overdoses did not go away. So please, Kim, tell us about that.
Yeah, I mean, you were exactly right. And the world's eyes were on COVID for, over 2 years. And really, there has been this growing epidemic that's been happening. And that's the opioid epidemic. And so in the last couple of years, between 2020 and 2021, the amount of overdoses has gone up actually over 40%. Nationwide, we're seeing an alarming increase in youth overdoses. The amount of deaths related to drug use of 10 to 19-year-olds has actually gone up 87%. In Oregon here, we average about 5 people die every week of an opioid overdose. And Douglas County is definitely not immune to this. We see anywhere from 20 to 25 overdoses per month. Some of those are fatal to overdoses. And I think there's a lot more that's happening out there and that we just don't know about. And so we kind of need to take a step back and really think about what has changed in the last couple of years. The overdose epidemic has always been there, but it's gotten worse. And I think it really boils down to one drug that's out there, and that is fentanyl. A lot of people have probably heard fentanyl mentioned, maybe not really fully understand what fentanyl is. But fentanyl is a scheduled opioid, a synthetic opioid, and it typically is used to treat chronic pain patients. So you'll see it prescribed quite a bit for like late stage cancer patients. It's a Schedule II substance. It's very similar to morphine. However, it is about 100 times more potent than morphine, and it's 50 times more potent than heroin. So it's very, very strong. But it is an effective drug when used under the supervision of a licensed medical professional. But these synthetic opioids like fentanyl are actually the primary driver behind the overdose deaths in the United States. And that's because of what we call illicit fentanyl. Now, illicit fentanyl is typically manufactured down in Mexico. It can be manufactured in the US as well. However, it usually comes up from the South, and it is sold into the illegal drug market here in the United States. It can be found in a couple different forms. We do have a powder and a liquid form. Powders tend to look a lot like other drugs. They look very similar to cocaine. Sometimes they can have a little bit of a color to them, like a pink or purple. That's something that we've recently seen within just the last couple months. But the liquids can actually be found in nasal sprays, eye drops, and then you can even like drop fentanyl onto a small piece of candy and ingest it. But a lot of this fentanyl is being mixed into other drugs to increase the potency of them. So they can be mixed into heroin, methamphetamines. They can be mixed into cocaine. And we're even starting to hear more and more of it being smoked with marijuana. But one of the really large problems is what we call the counterfeit fentanyl pills. And these are pills that are manufactured in the illegal drug market, and they are made to look exactly like a pill you would find from a pharmacy. So they're going to have the same markings, the same color. They're going to be the same size. And so a lot of people have been taking these counterfeit fentanyl pills thinking that they are, like an oxycodone or an OxyContin, when in fact they are actually a fentanyl pill. The scary part about all of this is that there is no official oversight There's no quality control that's happening out there with the amount of fentanyl that's being put into these products. All it takes is 2 milligrams of fentanyl to be a lethal dose. And out of the pills that were taken in by law enforcement and tested for fentanyl, about 42% of them actually contained a lethal dose, enough to kill somebody. And so there's a lot of inconsistencies with fentanyl and how much is in each of these products. We like to call this the cookie dough effect. And what this means is that you decide you're going to bake some cookies, you mix up your dough, you have it in your bowl, and then you mix in your chocolate chips. So you mix the chocolate chips and then you individualize each cookie on your sheet pan, right? Well, each cookie is going to be a little bit different. It's going to have a few more chocolate chips in one than the other. And it's the same thing that goes with all these drugs, and especially these counterfeit fentanyl pills. You can have one pill that barely has any fentanyl in it, and you can have another pill that has enough to kill 5 people. Just 1 kilogram of fentanyl has the potential to kill up to 500,000 people. It's very, very potent. And so a lot of people ask me, why are drug cartels or drug dealers doing this? They're killing their clients. But it's a pretty simple answer. I mean, fentanyl is very low cost. It is way more addictive than just the normal drug alone. And it's really not as long lasting. And so people are going to go back and buy more of it.
Yeah, fentanyl is a real game changer. I can remember in my medical career when fentanyl first came out, it was first used in the highest level surgeries like cardiac surgery. And it's an amazing drug because you have to give so little of it. So when we usually think of things in gram quantities, the fentanyl is dispensed in microgram quantities, so 1,000th of a gram. And this stuff was incredibly magical when we did cardiac surgery because the amount that you needed to give was just a tiny bit. And it was really very effective, very fast acting, very effective against pain, a strong euphoric effect, and then would go away relatively quickly. So it was really a great drug for cardiac surgery where somebody digging into your chest with a saw really does hurt. And then what we saw was that fentanyl was starting to be abused in the hospital. So we were starting to see back in the 90s that people would even use those little bits of discarded fentanyl. And that had a really potent effect. And we started to see people really get addicted to that. I think the potency, so potency means how strong it is for a given amount. So the amount of heroin it takes to kill you is typically a big heaping teaspoon. The amount of fentanyl that it takes to kill you is just a few grains. And so that's what makes this so much more dangerous. It also makes it dangerous. I mean, I can remember when I started, you think of opiate overdoses where people injecting too much heroin. Well, that's a hard thing to do. Somebody has to grow the heroin, purify the heroin, send it across the country. It stinks, so dogs can pick it up. And then you have to have people cut it and distribute it along the way. So a lot of people along the way. And it was easy to pick up, as well as there's some people just didn't want to inject. And so for that reason, heroin was much less of an issue. Now, when fentanyl can be made in a place overseas or in Mexico, shipped in the mail. So the amount that can kill you fits in a first-class envelope and then can get shipped to you. You cut out all those middlemen, and it's nearly free to make. I mean, it's a very easy drug to make. And so this has become an enormous issue. But what we're seeing, I think, is that people are reluctant to admit that they're using opioids. So tell us about the shame thing, because I think that's a big barrier.
There is. According to the CDC, it's actually 1 in 14 people in America have reported experiencing some kind of substance use disorder. I think the important thing to know here is that addiction can really happen to anybody, and especially with these fentanyl pills out there. A lot of people see a stigma around other types of drug use, such as heroin, needles, that sort of thing. However, they don't necessarily associate that stigma as much with pills. And so that's why you're starting to see some different populations start to use pills over other drugs, especially our young people. They just don't have the information out there. They don't know the dangers that are associated with those. But really, a lot of people are using drugs to cope with stress, trauma, mental health issues. There has been some people that have developed an opioid use disorder after misusing a prescription that was prescribed by their provider. But the thing to note is that addiction is a disease. It is not a character flaw. It's not, just with, with gender or, race, ethnicity, age. It can happen to literally anybody. But the good thing is that it's very treatable. We do have some really great programs here in Douglas County. We do have some outpatient counseling programs. We do have what we call the MAT program, which is medication assisted treatment, which combines medications with counseling services. But I think the important thing to do to really help somebody is that if you suspect somebody has an addiction problem or that they're really struggling, ask them if they need help. Because starting that conversation may be exactly what that person needs to hear to set them on the correct road to recovery.
And I can't stress enough how much medication-assisted treatment has really helped. I saw a little 2-year-old in the office the other day, just the most adorable little thing. And I said to the mom, well, I haven't seen the baby in over 2 years. What's been going on? And she said, you won't believe this, Dr. Bob. This is somebody I've known for a long time. I was a heroin addict. I said, well, tell me about that. And she started with the pain during the pregnancy, kind of got hooked on narcotics. Then they cut her off on the narcotics, and then she started buying opiates in the marketplace and started with heroin and then used some fentanyl. And she really was in a terrible state, got into a plan with medication-assisted treatment. She's back now clean and sober. She's doing a wonderful job with her 2-year-old. And so, I think people think that once you get addicted, it's the end. And in my experience, there's so many people who recover. And they are incredibly grateful and do well. So we have to keep people alive. So I know DPHN is working on a project to keep people alive when they're using, and that's our Naloxone project. So tell us how that's going.
Yeah, so the question is, what exactly is Naloxone? So Naloxone is absolutely amazing medication. Some people do know it as Narcan, but so Naloxone is going to be the medication. Narcan is going to be the brand name. So you'll hear those used both. But what Naloxone is it's a life-saving medication, and it actually reverses the effects of an overdose. And that could be an overdose from heroin, from fentanyl, other prescription opioids. It's amazing because it can actually restore breathing within just 2 to 3 minutes from somebody who completely had stopped breathing. And a lot of times it just gives you that little bit of time for emergency services to arrive and take over. So Naloxone really can mean life or death for somebody. And it's just a wonderful thing to have. It's easy to use. It's light to carry. It comes in a couple different forms, both an injectable, and most people have a nasal spray as well. And so what I recommend is if you yourself or somebody that you know is at an increased risk of opioid overdose, you should be carrying Naloxone on you. This could be somebody that has like a high dose opioid medication prescribed by a doctor, or it could even be somebody who uses illicit opioids like heroin. But the one thing I do recommend that is if you do carry Naloxone for yourself, I recommend that you tell people that you're with. Let them know exactly where it's at. Just say, hey, I have this in my purse, or it's in this pouch in my backpack. Just in case you do find yourself in that situation, they know exactly how to get to it quickly. Because again, this could mean life or death for you if you go into an opioid overdose. And Naloxone is very, very easy to get. You can actually go to most any pharmacy and you do not need a prescription. Just ask for Naloxone. Usually normal copays with insurances will apply in that situation. We also have a source of Naloxone at the HIV Alliance here in Roseburg. They do a lot of harm reduction services, but you would just go in and ask for Naloxone, and they will teach you how to recognize an overdose, how to use the Naloxone, and they will send you home with some. And they have also other harm reduction services as well, such as fentanyl testing strips, which is a strip that you can use to test your drugs to see if it actually has fentanyl in it. So they are a great resource in Douglas County here.
And they are. Naloxone is really an amazing drug. Having done medicine for a long time, there's only a couple of things that are really amazing. One is if you have low blood sugar and get glucose, within a few minutes, you go from deeply comatose to awake. But the other one is naloxone. So you take people who are all the world dead and are going to die unless they get treated with naloxone, and within a minute or two, they wake up and are back to almost normal within a minute or two. So it really is an amazing drug. And in my emergency kit, it's one of those things that I carry because it's something I easily may need to use and could use to help save a life. We have given naloxone to many of our law enforcement, and they carry naloxone, and anecdotally, they report that they're using it a lot and have saved really quite a lot of lives. You know, some people have this moral judgment, like, you know, this person got them into this situation. They need to suffer the consequence of the situation they got them in. I hope we get past that. You know, seeing this mom of this 2-year-old, if she had not gotten naloxone at the time that she had an overdose, that little baby would have lost her mom. And similarly, we don't do that for other things, right? When somebody clutches their chest with a heart attack, we don't say, well, you know, you ate a lot of cheeseburgers when you were young and you smoked, and so you kind of brought this on yourself, so we're not going to go ahead and resuscitate you. No, we go and resuscitate, we save a life, and then later we deal with those other issues that may have gotten them into this situation first. So naloxone is just an amazing thing. So we'll talk to you more in the future, Kim, because this is really one of those areas of public health where we think we're making a big impact, and it is a situation which is causing a lot of issues. So thanks for joining us today. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer, Douglas County. We'll join you again next week with COVID conversations and more. Take care.